Can a pelvic floor physical therapist check me for prolapse, or do I need to see my gynecologist? Hi, welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. I'm Justine Calderwood, pelvic floor physical therapist and certified birth healing practitioner. This is a question that we get from time to time when people reach out to us asking about prolapse and if they can come here at the healing spot in order to get checked for prolapse and to find out how bad it is, or even to verify if they do in fact have a prolapse. And I want to tell you that yes, a pelvic floor physical therapist can assess you for prolapse. I want to go in just a little bit about what a prolapse is, and then I want to talk to you about how we check for prolapse here at the healing spot. So, brief anatomy lesson here. What is a prolapse? Well, a prolapse can be a prolapse of the bladder, the uterus, or the rectum, or even the urethra. So those are the organs in the female pelvis. And when we talk about prolapse, it's basically where the organ is not in the position where we expect it to be. A prolapsed organ, simply put, is just that the organ has come down and descended down towards the vaginal opening, or possibly outside the vaginal opening, from where we would expect that organ to be inside the body. I'm going to tell you two ways that we check for prolapse here at the healing spot. The simplest way I'm going to explain to you is an intravaginal assessment. So I want to just start this video by saying this isn't necessarily what we do on day one when our patients come in. We typically treat prolapse very holistically, and we know we can make some changes external to the pelvis before we even do an intravaginal assessment. So if you are feeling a little bit anxious or nervous about an intravaginal or internal pelvic floor assessment, it's not something that we always do day one. In fact, usually we do it maybe the second visit or later. So I want to dive in now and just tell you first the very simple way that we would check for prolapse here at the healing spot. One would be, like I said, intravaginally. So we would glove up, okay, we would insert one finger into the vagina. And what we're checking for there is we come up underneath. We would do this with the person lying down on their back, and we can come up underneath behind the pubic bone here, and we can feel for where the bladder is and where the uterus is, and we can also turn the finger and check to see where the rectum is. And we're feeling for where is that organ at in the pelvic inlet here. So what we're feeling for at rest is the organ pulled off to one side. Does it seem to be hanging low? Can we visually inspect as we open up the labia on where that organ is resting? Is there any tissue sitting right at the vaginal entrance or protruding outside of the vaginal canal? And that would indicate that there may be some prolapse. So we check this at rest with you on your back, and we can check each organ where they're resting. The one thing that we can then do is check it with bearing down. And I like to use a balloon for this step because sometimes people are told, bear down like you are having a bowel movement, and that can be a little vulnerable for some people and make them feel like they might possibly have a bowel movement or, urinate while we're doing this test, and it can feel really vulnerable for them. So blowing up the balloon is not quite as forceful, so I like to start with that. And we can check that the position of the organ with that bearing down. Does the organ move with the blowing up the balloon, where we're kind of putting a little bit more pressure into the abdomen and the pelvic area? So we can do that lying down. And again, we can check at the bladder, at the uterus, and really even at the rectum. Then from there, we can have the patient stand up, and we can check again in standing, because typically people that have symptoms of prolapse actually feel them more when they're in an upright position, when they're sitting or standing. And so if we only check it lying down, we're not seeing the full picture of things. So having somebody stand up then, and again, going in intravaginally and first checking at rest, where are those organs at? Is there anything coming down a little bit towards that vaginal entrance? Is there anything coming out? And we can, just based on anatomy, we can decide on how that organ is resting and if it truly is prolapsed. Then we can repeat the bearing down with the balloon, and we can check to see what happens under pressure. So that's the first way. The second way, this is a little more scientific. It's really by taking measurements, we would know for sure on what the different stage of the prolapse is. Now, with the first technique, we can generally get an idea of where that organ is and have an idea of where the stage is with that. But this method that I'm going to go over with you right now is called the POPQ, the pelvic organ prolapse quantification. And what it is actually taking measurements at certain landmarks or anatomy into the vaginal space here, like external, but also internally. So we use this fancy little POPQ stick. It looks like a popsicle stick, quite honestly, but it has measurements, as you can see. So we use this to take certain measurements, and we're going to take measurements. Some of them are at rest, but some of them are with bearing down. And we want that bearing down because we do this test with you on your back. We actually don't do this test standing up because it'd be really hard to try to take some measurements in this way with a person standing. So we do the bearing down, and it is a little more forceful than the balloon. And what we're checking for, I won't get into all the specifics, but we're checking for basically what happens here externally. Is there a lot of bulging? And also just the space between the urethra down to the anus and this perineum to kind of know how much support that we have structurally for those pelvic organs. And then what we can do is we can take measurements of how long the vagina is itself, and then we can measure under that bearing down, where is the bladder, where is the uterus, and also where is the rectum upon bearing down. And depending on how close that organ is to the entrance to the vagina or how far out of the vagina it is, that helps us to stage the prolapse. So there are 4 different stages: stage 1, 2, 3, and 4. Stage 1 is mild, and stage 4 would be organ or organs outside of the body. So I won't go into all of that in this video, but you can at least get an idea that there are 2 different ways to measure for pelvic organ prolapse. And yes, most definitely a pelvic floor physical therapist can do this. So the advantage with that, I will say, is that pelvic floor physical therapists, we are trained in also treating this. Okay, we're trained in knowing how to make sure that the muscles are contracting better, how to do some release work into the connective tissue that can influence where those organs are in space and can really make a difference to the symptoms that you may experience with prolapse. That includes maybe some manual work of the bones around here where those muscles actually attach, and also some exercise and patient and lifestyle modification education. And that's key to actually managing symptoms of prolapse. So thanks for watching this video. I will say I've made some other videos in the Ed Talk series. You can look in this playlist and you can find other videos related to prolapse. I've done some very extensive videos where I describe what symptoms you might have for bladder, uterus, or rectal prolapse. And also there's some videos on how to manage this at home. So you can kind of piece it together. But I will say if you're struggling with prolapse symptoms at home, or you suspect you have a prolapse and you want to have an assessment, you want to have information, I would recommend the best thing to do instead of browsing through the videos and trying to piece things together is actually reach out to us here at the Healing Spot. Head to our website, healingspotpt.com, and pick whatever option works out the best for you. You can talk to a member of our expert team here prior to even stepping foot into our clinic, get all of your questions answered, and then you can choose to do a discovery session with one of our therapists, and we would be happy to go over the pelvic models, listen to your story, and really help you make the best decision for you when it comes to care. Thanks so much for watching this Ed Talk. We will see you on the next one.